Within the UBC Faculty of Medicine, the Division of Continuing Professional Development, known as UBC CPD, supports the lifelong learning needs of BC family physicians and specialists.
UBC CPD is able to plan, develop, deliver, and evaluate educational activities for physicians as well as other healthcare professionals designed to enhance their performance and optimize patient care.
UBC CPD is the largest and most recognized provider of continuing medical education and continuing professional development in British Columbia.
To meet UBC's mission of delivering education and evaluating education, we work with a number of different organizations. We work with health authorities, government agencies, medical organizations, national and provincial licensing authorities, and also we work with the faculties of medicine, and we work with these organizations in order to develop and evaluate education.
We've been able to develop many new programs that have led to better educated physicians and physicians who are able to then better take care of their patients.
We contribute to best practices in medicine, engaging physicians and stakeholders, both internal and external to the Faculty of Medicine. We take great pride in our work and strive to be a credible source of continuing education. UBC CPD is an accredited provider of study credits for Canadian and American specialists and family physicians to help them meet their continuing medical education needs.
I have been attending UBC CPD continuing medical education events for the last 10 years. Having accredited events, of course, is helpful from the point of view of keeping up my mandatory accreditation.
Our standards of accreditation are extremely high, and a UBC CPD accredited event guarantees reliable, quality education for healthcare professionals.
I think most importantly, though, is that it stimulates me by both confronting me with what I don't know in the material that's presented, but also I have a chance to see other physicians around the province, and it just inspires me, challenges me to try and keep up with them, getting better at what I do.
UBC CPD also provides study credits for external programs. Getting an event accredited can seem like an overwhelming task. The UBC CPD accreditation team can help simplify the overall process. The accreditation website easily assists an applicant through the steps required for a complete application. And assistance is only a phone call away. You can be assured of being treated to personal one-on-one service throughout the application process. CPD develops and manages medical education conferences and other events in BC and across Canada.
Well, I have engaged UBC CPD to work with me in the organization of this year's 2011's Canadian Geriatric Society annual meeting, which happens in Vancouver. And I found them to be extremely helpful and very resourceful, and I would describe my overall experience as very positive.
We can manage event details by offering one-stop shopping and customized services.
Because everybody learns differently and wants something different out of their CPD, we have over 30 conferences and events each year.
The focus is on event logistics, content development, planning committee support, securing quality presenters, financial management, and registration services.
That we do interactive case-based workshops. It tends to be the most popular, but also do some plenary style conferences like See Me in the Run, where it's short, clinically focused.
I'm particularly impressed with their ability to focus on details. So their work is very meticulous, they're very self-motivated, and I'm very happy to be working with the team as a whole.
And we continue to be the one-stop shop for most physicians and all physician types in this province.
UBC CPD has a depth of experience leading research and evaluation projects. It assesses learning needs and develops educational initiatives to engage physicians and other healthcare professionals in optimizing practice and healthcare outcomes. The team has expertise in quantitative and qualitative methodologies that support varied educational initiatives. UBC CPD conducts its research and educational programming in partnership with several provincial and national organizations.
The goal of the project was to understand the cancer screening needs around the province, It was a very rewarding experience. The team was highly professional and well-grounded in their research methodology, so that we can give valuable information and information that truly reflect what their needs are.
The reason that this is important is it helps physicians provide better patient care, and it's ultimately the patients and public that benefit from this education.
We understand that live conferences are only one of many ways to effectively educate physicians. We therefore also organize technology-assisted program delivery, including online education, video conferencing, and we provide resources on our website.
So Trail is considered a regional hospital and has a good complement of specialists, but because we're a large distance from our nearest tertiary referral, Kelowna, much less Vancouver, getting good in-person education is a challenge. We've come to rely more and more on technology such as video rounds, video conferencing, and web-based training.
Simulators and audience response systems are also integrated into many of our educational activities to improve learning. The benefits of a live webinar include interactivity in real time, Q&A with an expert, and the convenience of participating in up-to-date CME from the comfort of your own home or office through your computer.
I'm the medical director for This Changed My Practice, which is a new online educational resource from UBC CPD. One of the things I've noticed is that GPs are inundated with information all the time. And I think it's really hard to decide what is enough of an impact, what article or what clinical trial, what data is enough to really impact your practice such that you're going to change something, or maybe more importantly, reaffirm what you're doing. So we envisioned This Changed My Practice as a way of pulling key opinion leaders or thought experts or experts to learn about new interventions or new ways of looking at data, or how data might change the way they approach a specific disease process. And I envisioned it almost as if you were sitting down with your favorite endocrinologist or cardiologist or psychiatrist and say, what article in the last year changed what you do with your patients? And we're hoping that this has a large impact on the way physicians practice.
We also use training equipment such as simulators to create real-life learning situations in order to facilitate lots of hands-on practice and integrate the varied clinical skills required to provide high-quality care. For more information about UBC CPD, as well as our educational and research programs, please visit our website.